Thank you. Started the timer and here is your question. Please keep reading and then tell me, because there are 2 more slides.
Okay,
There's
ma'am.
nothing much. Yes. Can you read here, because my
Yes,
toolbar
ma'am.
is in the way.
I can read, ma'am.
Okay.
Okay.
Yes, next.
Yes, ma'am.
Yes. Yes, great.
Okay. Yes,
Once
ma'am.
you're ready, take your time, because in exam you'll be given 9 minutes. So
Okay,
once
ma'am.
you're
I'm ready.
Okay, started your timer. If you have read and understood, considering it communication skills station, kindly begin.
Okay. Good eve. Good evening, sir. I'm Doctor. Okay, I'll come into the station. I'll wash my hands, then I'll introduce myself. My name is Dr. Abbas. I'm a SHO in Dr. Mann's team. I'm calling to speak to Dr. Smith, who is a trauma head, about a patient. Could I check that I'm speaking to Dr. Smith? Mr. Smith?
Yes, it's me.
Okay, sir.
Yes, can you summarize your case?
Yes, sir. My patient is my patient is a 20-year-old motorbike rider who presented with following road traffic accidents. It was a hit and run, who presented with open tibiofibular fracture, and who presented at 11:35 p.m. with open tibiofibular fracture following road traffic accidents. He was also unconscious initially, but on presentation, he's fully conscious. He has had abdominal examination, which revealed an open tibiofibular fracture, and also had noticed to have progressively cold and pulseless left lower limb, and he subsequently, right lower limb, and abdominal distension. He has had an X-ray that shows an open tibiofibular fracture, and ultrasound scan of the abdomen shows a free fluid within the paracolic gutters. His vitals are normal, and X-rays done shows. The blood work done shows were normal. However, he has elevated C-reactive protein. He My worry, I'm worried because he of the pulselessness and coldness of the limb, and the worsening pain he's having. I'm afraid that he possibly has an arterial injury, sir. Lower limb vascular injury, sir, or with possible development of compartment syndrome. That's why I'm calling you, sir.
Okay, you said that his vitals are stable. Did you check on the vitals?
Okay. Yes, I'm not sure at the moment, but I would have loved to check for the blood pressure and the pulse too. I would check the pulse rates and the also, yes, and then the oxygen saturation and his respiratory rates. I would monitor that regularly every 15 minutes, considering the fact that he's unstable, and also
Okay.
monitor the yes, temperature and also his temperature.
You said the patient was unconscious initially, but now his GCS is 15. What do you
Yes, sir.
think is the cause?
Okay, probably he's having a resolving mild traumatic brain injury. However, it can also be it can also be a lucid interval, sir.
Okay, well, what is that?
Yes, lucid interval is defined as a period of regain of consciousness following initial head injury in a patient who has had traumatic brain injury, probably as a result of following which the patient will subsequently lose consciousness again. And this is usually seen in patients with either epidural or subdural hematoma.
Good.
So what is the most urgent thing that you're concerned about?
Yes, sir. My worry for this patient is that he probably has arterial injury from the open tibial, right open tibiofibular fracture, and then I'm worried that he may lose the limb. So it's urgent that he has urgent assessment of the limb and subsequent intervention.
Okay. You said the foot is pulseless and cold.
Yes.
What do you think?
It's possibly a compartment syndrome, sir.
Okay, and how do you want to manage that?
Yes, I would like to do a fasciotomy for the patient in order to relieve the pressure within the compartment. Prior to that, I would yes, I'll do a fasciotomy for the patient and subsequently
okay, you're going to do it yourself?
But I would invite the trauma con. That's why I'm calling you, sir.
Not invite. Yes.
You said there's abdominal distension and tenderness, and with the free fluid collection in the right iliac fossa. What impression does that give to you?
Yes, sir. It's possible that he has an intra-abdominal collection, likely from blood or from perforated bore because of the trauma, sir.
Okay, so what do you want to do about that?
Yes, sir, I would love to. It may require him having a laparotomy, but I would also want to do.
You will directly do a laparotomy?
He already has an abdominal ultrasound scan that shows free fluid, intra-abdominal free fluid collection. To confirm, I may want to do an abdominal pelvic CT scan. But because okay, yeah, he's hemodynamically stable, so I'll do after the vascular intervention, the fasciotomy and consult to vascular has been concluded. I'll do an abdominal pelvic CT scan to assess that, to stage to see if to assess the problem and then possibly to classify whatever injury that is present.
Okay. So you said he is hemodynamically stable. Then why are you calling me right now?
Yes, because it's urgent, and because of the limb he possibly has an impending compartment syndrome, and it may lead to loss of his limb, and that is very urgent. That's why I'm calling you, sir.
Okay, for the limb, what do you want to do? Any investigation you want to do?
Yes, I would want to do a Doppler ultrasound scan of the lower limb. However, it's urgent to do a fasciotomy. It's also important.
What you will find on the Doppler?
Yes, sir. I may see the presence of monophasic waves which may indicate the presence of decreased blood flow or absence blood flow to the distal portion. There may also be absence of Doppler color interrogation with distal vessels.
He's on C collar.
I'm not sure about that, but however, I would confirm, and if it's not on it, I'll place a rigid Philadelphia collar.
Is the patient dehydrated?
I'm not sure about that, but I would confirm, and then I would ensure that I would secure 2 white ball cannulae and give him IV fluid, IV crystalloids, and rushed. And then I would assess his blood pressure at his blood 1 liter stat. Then I would measure his blood pressure, every pulse rate, respiratory rate and vitals every 15 minutes to assess, and then I'll pass a urinary catheter to monitor higher hourly urine output and to ensure he's fully resuscitated if he's dehydrated. So.
Okay, doctor. Thank you.
Good.
So.
Nice discussion. So can you please give feedback first?
Yes, he is very good.
Yes.
But maybe in some points, like he can be brief. Like I felt that he was a bit detailed. 1 or 2 questions he could keep it like brief. Like
To the point,
for
you mean?
example, yes, to the point. Like it is consuming his time, no? Like when
Yes.
I ask a particular question, like for example, about dehydration, like he can just say like whether he is dehydrated or not. Like he doesn't have to mention like what he will do, because I didn't ask that.
Yes.
And
if he'll answer
another-
that, he'll lose 1 point because that was your next question.
yeah, and another question, like yeah, when I asked about the pulseless, why his foot is pulseless, he could just mention that it could be because of that, and he doesn't have to tell what he's going to do, because I didn't ask about that. So
Okay. Yeah.
maybe like these few questions, when if you can be just to the point, then maybe it will make the consultant happy. Otherwise, you're good.
Yeah.
Thank you very much, Dr. Karma.
Thank you. Nice communication was going on. Yes, but then this is also one very important request. Always answer to the point. So the next question examiner has to ask, they can ask, and you can secure the mark. If you'll answer without asking, then you may not even get the mark, or they'll maybe find something and they'll trap you in that answer. So always be careful, give answers to the point and short. Good, very good. Thank you, both of you. Here is your